We have a lot of ligaments in our foot and ankle. They basically attach bone to bone, and anytime you tear those ligaments or injure them in any way, you can develop a sprain. These can be with or without a fracture, just depending on the severity of it. Different stages, different classifications, and that always can guide us to treatment options. Treating the sprain is either conservative or surgical. Depending on the type of severity or the classification of the sprain, usually we would offload you, put you in some sort of brace. Whether it's with or without fracture, that depends on if we want to go and proceed with surgical options, just depending on what type of injury that you've had, if it's acute versus chronic as well. Podiatrists and foot and ankle surgeons, they focus their expertise, they focus their experience, their training all on the foot and ankle. We can determine which classification that you fall into. We can use that to provide treatment options and provide a better outcome. Imaging is going to be very big in this. We always take x-rays anytime someone comes in with foot and ankle pain. If we don't see anything obvious, we may get additional imaging, whether it be MRI, CT scan, ultrasounds, just to determine if it is mainly a soft tissue injury, if it's a bony injury, or if it's a combination of the two. Usually I say it's easier to fix a broken ankle than a sprained ankle. Sprains can usually range 4 to 8 weeks depending on the severity, depending if it's acute versus chronic. With an ankle fracture, we can pretty much determine that the bone should heal in about 6 to 8 weeks. It depends on how bad the injury was. It depends on limiting factors, whether it's mainly soft tissue versus osseous or bony versus a combination, and how willing they are to accept treatment. And sometimes we offer physical therapy. Some patients may need other alternatives such as injections and things like that if they develop any capsulitis or things going on other than the sprain or the fracture. So if you're developing any soft tissue or foot or ankle pain or anything like that, always call the Horizon Foot and Ankle Institute. We can see you right away and determine exactly what your problem is and the best way to treat you.